Deputy Wallace.
Thanks very much, Tom Colan, and thanks for selecting the issue. Minister, the waiting list for children and adolescents for first-time assessment for occupational therapy as of January 19 was 16,868 nationally, a fairly depressing figure. However, the information I received via parliamentary question last week reveals huge inconsistencies in the number of children and adolescents on waiting lists in different counties and local health officers' areas. The delivery of occupational therapy across the country is deeply unequal. For example, there were 1,353 children and adolescents in total on the waiting list in Wexford, according to the January stats I received, and 666 of these children and adolescents were waiting for over a year for an initial assessment. Contrast that to County Clare, for example, where there were only 41 children and adolescents on the list, 39 of whom had been waiting for less than 12 weeks, and where the remaining 2 children on the list had been waiting for between 12 and 26 weeks. The total number on the waiting list in Limerick as of January was 95. Only 5 children in Limerick were waiting for more than 26 weeks. These wait times are not ideal, but I think most people would agree that the occupational therapy departments and staff in these local health areas are performing well based on these figures. However, the national average number of children and adolescents on waiting lists for paediatric occupational therapy in January was 411. The number of children and adolescents waiting for an assessment in Wexford was more than 3 times the national average. The number of children on the waiting list in Wexford was 33 times higher than the number on the waiting list in Clare. Wexford has the second highest number of children on the waiting list according to the data I received. Only Laois Offaly had a higher figure. The numbers on the waiting list in Wexford, North Lee in Cork and Laois Offaly are total outliers, and those 3 lists need to be tackled as a matter of urgency. In its response to me last week, the HSE said it could not provide a further breakdown for the number of children waiting for more than 52 weeks. However, a letter from the HSE I recently received from a parent of a child awaiting assessment in Wexford shows that occupational therapy in the Wexford Local Health Office is currently dealing with June referrals from 2016, Minister, with a waiting list of 2 years and 9 months. The letter goes on to state, and I quote, "Resources are limited in Wexford with a 40% reduction in staffing in the past year. According to a children mapping process, Wexford requires 35 posts to deal with the demand for this service." The letter is dated the 14th of March 2019 and notes that, as of that date, there were 1,429 children and young people on the Wexford Occupational Therapy waiting list. This represents an increase of more than 5% on the figure I received from January. Things are getting worse, not better. The tone of the letter is quite remarkable. It was sent by the occupational therapy manager in Wexford, and she is clearly, based on the letter, absolutely exasperated and worn out by the lack of resources available to her and her staff. I'm still waiting for an answer from the HSE in response to another parliamentary question in relation to the number and locations of paediatric occupational therapist vacancies that exist nationally. But I've been told by a parent in Wexford that there are currently 3 occupational therapy vacancies in Wexford at the moment. What steps is the Minister specifically going to take to recruit occupational therapists in Wexford? How many occupational therapists are currently working in Wexford? And how many occupational therapists is the HSE currently trying to recruit for Wexford? When does the HSE hope to appoint these occupational therapists? And does the Minister believe that occupational therapy services for children and adolescents is adequately funded?
Minister.
Thank you very much, Chair. On behalf of Minister Howes, I'd like to thank Deputy Wallace for raising this issue. The Government acknowledges the challenges that exist in access to the provision of paediatric occupational therapy services in Wexford. The Government and the HSE are committed to improving access to these important services. Minister Howes has been advised by the HSE that over the past number of years the demands have significantly increased for paediatric occupational therapy services in Wexford. Along with the increased number of referrals to the management in the HSE, it is reported that there are more complex demands are being made on this service. With regard to the numbers waiting to access paediatric occupational services in Wexford, Minister Harris has been advised by the HSE that all applicants for those services are prioritised upon receipt of the basis of clinical need. High priority referrals are managed by the HSE in accordance with the standard operational protocol, with the children of the highest clinical needs being seen first. A number of initiatives have been implemented by South East Community Healthcare CHO5 to improve access to timely services in Wexford. These include an expanded occupational service to provide assessments and 2 treatment sessions for school-aged children. This is an expansion of the existing service. In addition, additional clinics have been provided under the new initiative. The Central Remedial Clinic is providing an outreach clinic, and increased patient clinics are being offered to address the needs of longest waiting. The CHO5 is also increasing the number of group programmes on offer into school-age service. 110 children are currently being assessed and provided with group interventions in the first quarter of this year, which aims at providing interventions prior to entering the school-age service. In order to address the waiting times nationally and improve access to the service, this government has committed to an increased number of occupational therapists in primary care. The HSE National Service Plan for 2019 contains the commitment to recruit 170 community and nursing therapy posts, including 40 additional occupational therapist posts. The additional occupational posts will focus on addressing patients waiting over 52 weeks. The HSE anticipates that over 350,000 primary care occupational therapist patients will be treated in 2019. The development of the primary care is central to the government's objectives to deliver a high-quality, integrated and cost-efficient healthcare system. The Programme for Partnership Government and Sláinte Care commits to shifting the model of healthcare towards a more comprehensive and accessible primary care service in order to deliver better care close to home in communities across the country. The HSE has also established services improving groups to develop new standards models of service, providing support the delivery of occupational therapists and other therapy services. The National Service Plan for 2029 commits to the implementation of recommendations from these reviews on a phased basis within the existing resources, which will help to address difficulties and pressures ahead in therapy services. And I'll come back to the Deputy when I come back in. Thanks.
Deputy Wallace.
Thanks, Minister. And Minister, I know it's not your fault, right? But this is crazy. I mean, Minister, you're telling me that the HSE intends to recruit 40 occupational therapists nationally. I mean, there's 35 occupational therapist posts required to meet the demand in Wexford, according to the occupational therapy manager in Wexford. I mean, that's off the Richter scale, like. I mean, that's not going to. What kind of an impact is 40 going to make on the problem nationally if there's 35 needed in Wexford? I mean, it won't scratch the surface of the problem. I mean, I don't understand that. I mean, the waiting times, Minister, are shameful, and they make a mockery of the idea of early intervention. I mean, the disparity between the different LHOs area beggars belief. These children are waiting for an initial assessment only, and then they would have to wait further for a further appointment. I mean, the number of children waiting for an assessment in Wexford is more than 3 times the national average. Can the government explain that to me? I'd like an explanation for that, because, Minister, I think somebody is responsible for that. Who? I don't know. But I think you have a responsibility to hold somebody to account for that. There has to be an explanation. You probably don't have it in front of you, Minister, but I think the government should supply it in fairness. And the people of Wexford and the parents of the kids waiting for their initial appointment, they deserve an explanation. Listen, Wexford, we know, is the 3rd most deprived county in the country. And in some areas we're actually the worst. It's unbelievable, right? I mean, and that letter from the HSE that I got from a parent of a child waiting assessment in Wexford has showed that occupational therapy in Wexford Local Health Office is currently dealing with June referrals from 2016. This is March 2019.
Thank you, Deputy.
Please, Minister, can we get some answers and some accountability?
Minister.
And again, I want to acknowledge Deputy Wallace's concerns around this. Unfortunately, Deputy Wallace, I don't have the statistics in front of me that you're talking about. All I can tell you is that the government has acknowledged and the Minister has acknowledged the challenge that is existing in providing paediatric occupational therapist services in Wexford. There is a campaign to recruit people across the country, and in some areas it is more difficult than others. And I'm not here to give you any answers on why one community or one area would have more children longer on a time than other areas. I don't honestly know, to be honest with you. Can't understand that myself. However, the challenges that face us all are to make sure that children who need intervention is provided for them. And as I said in the opening address, the inclusion of expanding services for school-aged children and additional clinics delivered by the Central Media Clinic to address the needs of the longest waiting. I think there's some significance in that now in our schools there is intervention in schools and becoming more prevalent even with speech and language and occupational therapists as well. So, Corla, I'm here to, I suppose, read a statement, but I'm here also to take down the concerns that has been raised by the Deputy and to acknowledge the fact that in his role representing an area like Wexford, that there are needs there that needs to be addressed. Unfortunately, I can't address them on that level that he needs at the moment. However, I will, as usual, relate the information back to the Minister and ask him to come back to you himself on a personal basis around some of the statistics and when people will be seen recruiting in Wexford into the services that's needed. And unfortunately, Chair, I don't have any other answer for Deputy Wallace, only that I can read the prepared response in the conclusion, but it just outlines what I've already said to you in the opening statement.
Thank you very much, Minister. I think we're